Welcome to another lecture in the 0012 Future Formulation series. Today we're going to talk about a subject which is very close to my heart, which is probiotics. So, if you don't have one already, get yourself a cup of tea or coffee, or a cold drink, I don't mind. I, of course, have a cup of coffee. Come back, sit down, relax, and let's make a start. Let's start with the learning outcomes, or what you should know by the end of the lecture. The first thing is, I want you to know what the gut microbiome is, what's its role in the body, and most importantly, what disease states are implicated in a degree of gut dysbiosis or imbalance, as we'll see later. And it might surprise you the number of disease states that are linked to gut dysbiosis. It's also kind of important to understand that antibiotic treatment, given in the best of intentions, can sometimes make the situation worse if we focus on gut health. So we'll have a look at that. I want you to imagine that you are dealing with a consumer that comes into your pharmacy and they ask you about probiotics and they want to have a discussion with you. You should be able to explain what products are on the market and also which ones they might buy if they want to buy a particular product. And within that, I want you to see that the formulation of the probiotic is absolutely essential in making the product work properly. For a probiotic bacterium to have any effect in the body, it's got to get to its site of action. And the site of action is in the gut, right? And so one of the main challenges of a probiotic formulation is to make sure that the bacteria survive the challenges of oral delivery. And those would be acid, low pH in the stomach, and then bile salts concentration and pH in the small intestine. So formulation of a probiotic supplement is really important in making sure it works properly. So we'll have a look at that. Then we're going to have a look, using an example from my own laboratory actually, of how a probiotic supplement can actually modulate the gut bacteria, and we can see what implications that has for human health. And I'm going to end with a couple of technical definitions. That's next generation probiotics and live biotherapeutic products, both of which have special meanings, and so we'll see those at the end. Now, I do recognise that the 0012 series is long. It has a lot of really complicated lectures and that you might feel overwhelmed by some of the topics that you've got to revise. So please rest assured, probiotics is a relatively simple topic. We're not going into it in huge detail, principally because a lot of that detail isn't really understood. So I just want to give you a flavour for what the gut microbiome does, what the implications are if the gut microbiome are dysbiosed, and how probiotics can help change that. So nothing too stressful. Hopefully you should get on and enjoy the lecture. So let's think first about the human gut microbiome. And you may know some of these things, but essentially it's the bacterial population that lives in your gut. If we think about your GI tract, it goes from mouth to bum. And as you go along the GI tract, the number of bacteria is constantly increasing. If we look in the mouth, there are a reasonable number of bacteria, but as we go into the stomach and the small intestine, there are virtually no bacteria. It's only when we start to get into the large intestine, and in particular the colon, that the number of bacteria starts to increase enormously. I'd like to be able to tell you that in a typical human being there are X number of bacteria in the gut microbiome of Y number of species, but the reality of the situation is the gut microbiota varies person to person, so there is no one standard or ideal gut microbiome. What is important is to recognise some interesting facts about the number of bacteria in the colon. One is that you've probably got somewhere between 6,000 and 10,000 different species of bacteria living natively in your gut. One of the reasons that nobody really understands what a healthy gut microbiome is because we can't really characterise all of those bacteria, and even if we did, it's really difficult to work out what each one may or may not be doing. So all we can do at the moment is do an analysis of the total number of bacteria which are there, but we don't really have an understanding of what each one is actually doing. I'm sure that over the next 10 to 20 years, it will become a lot clearer which bacteria are doing what, but right now that information isn't there. You have somewhere between 1 and 2 kilograms of bacteria in your gut, which is a kind of scary number, isn't it? I always think it's kind of scary. And because the bacteria are really small, if you work out the percentage of cells in your body which are bacteria, it's roughly 98% of all the cells in your body are actually bacterial. You're only 2% human, so that kind of surprises some people. Partly that's because eukaryotic cells are a lot bigger as well than bacteria. If you think about the number of genes in the bacteria that are in your gut, there's around about 2 million genes compared with around 20,000 genes within a human. Now if you think about what that means, it's kind of important, because when you eat food, you think you're eating for yourself, but you're not really eating for yourself, you're eating for your gut bacteria. Because all of that food that you don't readily absorb, so simple sugars and amino acids you readily absorb, everything else, principally complex carbohydrates and indigestible fibres and things like that, they end up in your colon and your bacteria degrade them for you. So think about what that means. It means that the bacteria are taking foodstuffs that you can't ordinarily digest. They are breaking them down with digestive enzymes, principally to release glucose, although they'll use other molecules if they're there. And then in metabolizing that glucose, they are producing waste compounds. If you've got 6,000 different species of bacteria, then each one, well, at least each species, is going to produce different waste products. Sometimes those waste products, waste to a bacterium at least, are not waste to you, and you can get some really useful compounds from what would otherwise be waste food. So for instance, imagine a bacterium produces a vitamin that you wouldn't ordinarily get from your food. By having that bacterium in your gut, it's degrading glucose, but it's producing that vitamin, so you actually benefit from that bacterium. Think also about what it means if you swallow a drug substance, for instance. A bacterium doesn't know that a drug is a drug. It just looks at it as another compound which may or may not be degraded. So people often say that the gut microbiota has the metabolic capacity of a liver. That means it can metabolize the same range and breadth of compounds as your liver can. The difference is everyone's liver should in principle be degrading drugs the same way. So if you or I both take paracetamol, for instance, our liver will metabolize it the same. But before it gets into the bloodstream, the paracetamol actually encounters our gut bacteria. And your and mine gut bacteria might be different. And so the way that you metabolize compounds will be different from the way that I metabolize compounds because of the range of gut bacteria in our respective guts. We can split bacterial groups into phyla, and the main phyla that are found in the human gut, microbiota at least, are Bacteroidetes and Firmicutes. I'll have a look at those in just a minute on the next slide. But there are some smaller groups which are also important, and those include actinobacteria and proteobacteria. And when we think about dysbiosis in particular, or an imbalance in the ratio of bacteria in the gut, proteobacteria is often a sign of dysbiosis if their levels are raised. So on the slide you can see the four main phyla that we're talking about: Bacteroidetes, Firmicutes, Actinobacteria and Proteobacteria. And then there's just some information about each one of those groups. Bacteroidetes are gram-negative anaerobes, which ferment glycans and complex carbohydrates. So in the main, those are good things, okay? Because what happens is indigestible fibre and carbohydrates is a sort of foodstuff that you're going to excrete, because you can't yourself extract any useful energy from them. But because they can degrade those, they can produce useful compounds from them. Firmicutes are gram-positive bacteria, and you may have heard of some of them, Clostridia and Bacilli, for instance. Actinobacteria are gram-positive and include Bifidobacteria, that's also a probiotic species, and Streptomyces. And then Proteobacteria include those sorts of bacteria which you generally associate with bad effects when they're in the gut anyway, such as E. coli, Salmonella and Legionella. So proteobacteria are usually a sign that something's not right in your gut, okay? Now I said already that we don't really understand what a good bacterium mix is in your gut, but there is evidence to suggest that if you've got a ratio of Bacteroidetes to Firmicutes, which is a little bit imbalanced relative to a healthy person, whatever a healthy person is, that it can cause problems. And one example, it's from a paper in Nature a few years ago, is if the ratio of Bacteroidetes to Firmicutes is reduced, for instance, that's often seen with obesity. So there's a number of indicators, at least, that the ratio of bacteria in your gut is kind of related to gut health, as we'll explore in a little bit. If I said to you, what disease states do you think might be related to bacteria in your gut? You might, for instance, say to me, well, some of the gut conditions, maybe Crohn's disease or ulcerative colitis. What about IBS and IBD? And I'd say, I think that's a good idea. I think some of those disease states probably are linked to gut dysbiosis. But there are in fact a number of others. So obesity, I just mentioned. Maybe you might have thought of that actually, because obesity goes with food intake, doesn't it? And food intake is in the gut, so I can kind of see that. But there are some interesting ones. Autism is one, which is linked to dysbiosis in the gut. You might not have thought about that. Allergies is another one. Autoimmune conditions, we talked about those, Crohn's disease and ulcerative colitis, for instance. Parkinson's disease. I bet you didn't think that Parkinson's disease is related to dysbiosis in the gut, but there's growing evidence now that Parkinson's disease starts with constipation, lifelong constipation. If you think about what that means, it means that the gut wall is constantly being pressed against by feces because they haven't been expelled from the gut. And so your gut wall is always under pressure. And if that gut wall is under pressure, the chances are it starts to become leaky. So the join between cells becomes weaker, and that allows compounds to cross into the bloodstream. And those compounds can travel around the body. And if they get towards the brain, they can start to cause neurological conditions. So there's a lot of evidence now that maintaining a healthy gut, and by healthy gut I mean a healthy gut microbiota, is implicated in maintaining good health overall. How do we get a gut microbiome which is dysbiosed? Dysbiosed means out of balance. There are two key reasons. One would be diet. So I've said already that when you eat food, obviously you're eating for yourself, but principally you're eating for your gut bacteria. And so the mixture of bacteria in your gut is going to be reflective of the type of diet that you eat. Okay. The other one is infection. So if you've swallowed something and some opportunistic pathogens have got into your gut, they can then grow out of control, and that can also cause a number of really serious disease states. So one of the things people do if they've got a gut infection is take antibiotics, because you think that antibiotics is going to get rid of an infectious agent, and that's true. You know, it is true that if you've got an infection in your gut, taking an antibiotic is a good idea because it will kill the infectious agent. But the risk is it will also kill all of the other bacteria that are in your gut as well. So all of the good bacteria that reside in your gut we call commensal gut bacteria. So when you take an antibiotic, the risk is not only do you reduce the infection, you also reduce your commensal bacteria. So think about all of those bacterial groups together. The antibiotic has reduced all of them. If the pathogen is the fastest to recover, then what will happen is you'll take an antibiotic, you'll reduce all of your bacteria in your gut, and the pathogen will be the fastest growing back again. That would not be a good situation. Worse, because the bacteria that survived the original antibiotic treatment have grown back again, they're going to be resistant to that antibiotic, aren't they? So what often happens in hospitals is you can enter with a gut infection and you'll be put on a pathway of care. I'm sure you're familiar with that. And it will say, give a patient this antibiotic, and you'll start with the antibiotic which is least potent. So you'll take that antibiotic, the chances are you'll reduce your commensal gut bacteria, you might reduce the infection a little bit, and then the infection comes back again, stronger and more resistant. Then you take the next line of antibiotic and the same cycle repeats. You generally destroy your commensal gut bacteria and you end up creating a multi-drug resistant pathogen. Okay? So when you hear things like MRSA, which is methicillin resistant Staphylococcus aureus, for instance, some of those species have actually been created by constant antibiotic therapy, and you can end up in a really serious situation when you have a multi-drug resistant pathogen which has completely taken over your gut and you've got very little commensal gut bacteria left to do anything about it. Worse, there's no antibiotic therapy left because you've taken them all, which is how you've got in that situation in the first place. And quite often you can end up in intensive care with a raging multi-drug resistant infection that you can't do anything about. And really the only option for treatment at that point is fecal transplant, which I believe Abdul is talking about on this module. And as you might imagine, that is both unpleasant, not necessarily offered by all hospitals, and also you need a suitable donor, don't you? So these are quite serious situations to be in. I personally know several people that have ended up in intensive care with really raging multi-drug resistant infections because of this approach of using multiple antibiotics. I put on this slide here that some of the infections you might have heard of, so MRSA and C. diff, for instance, they are actually reportable. And so a hospital has to keep count of the number of patients that have MRSA and C. diff infections, and they will be fined if the number of infections goes over a certain limit. So one of the questions that we've been thinking about, especially in my own research group, is it possible to consider the use of probiotics instead? Can probiotic treatment replace fecal transplant? But more importantly, could it replace antibiotic treatment in the first instance? Because if you could not give antibiotics, you're not destroying the commensal gut bacteria, are you? And so you should be able to get to a good endpoint, but without doing all the collateral damage that antibiotic treatment causes. Now, we can't really talk about whether probiotics are or are not a useful thing if I don't tell you what a probiotic is in the first place. So you may know this, but if you don't, the World Health Organization actually provides a definition of a probiotic, and it says it is any bacterial species which, when ingested in sufficient quantity, confers a health benefit to the host. In other words, it's a bacterium which, if you swallow, should provide a health benefit to you being the host. Is this a large market? I hear you ask, the probiotic market, and the answer is yes, it is rather large. It is estimated that by 2022, so just next year, $57.4 billion worth of probiotic supplements will be sold worldwide. That is a lot by any stretch of the imagination. It's more than the sales of the top 10 best-selling drugs combined, I think. Although I provided that table before, didn't I? So you can have a look at that and see whether you think that's true or not. Nonetheless, it's a very large market, partly because a lot of people buy probiotic supplements or they keep probiotic foods in their diet. Okay, so a lot of people will buy probiotics whether they do or don't feel unwell because they think it's a good thing to try and maintain gut health. How do healthcare professionals view probiotics? You're going to be a healthcare professional, right? So you've got to have a view on this. The answer is, I think, with scepticism. I worry sometimes that probiotics are sometimes viewed alongside homeopathy and homeopathic remedies in the pharmacy world. That is that people believe there's no scientific evidence whatsoever that these products actually can do any good. And so one of the reasons that we started researching probiotics was simply to get some scientific understanding of whether probiotics are or are not effective. Okay? Why? Why do healthcare professionals not really believe in probiotic products in the first place? One, I think there's a lot of clinical studies using probiotics, and for every study that says they do something positive, there's another one that says they do nothing at all. I think if you look closely at those probiotic studies, what you'll find is that no one really pays attention to how the probiotic was actually formulated in the first place. And I think this is a really key issue which we're going to come back to later on. If you don't get the bacteria into your gut alive, they're not going to do anything, are they? And so you can convince yourself that a probiotic is ineffective, but what you've really asked is for people to swallow tablets containing dead bacteria, and it's unsurprising it's ineffective, right? So you have to pay attention to the way that the probiotic is formulated. So that's one issue. I think people don't really understand which species and strains of bacteria are going to be the best. So that's something we're going to look at. The product itself, as I said already, has got to be able to deliver viable probiotics to the gut. And the last one is patient use. I tell people all the time, if you're going to take a probiotic supplement, take it in the fasted state, because you really don't want that probiotic sitting in your stomach for a long time while it's pumping out stomach acid to degrade food. So it's all about how the patient actually uses the product as well. Okay, I think it is changing slightly. One reason I think this is because Steve asked me to give this lecture on this module in the first place, and it's about future formulation, right? So that implies that he at least thinks probiotics might be a viable formulation strategy in the future. But also the US FDA, it's always the FDA, isn't it, does actually define a number of probiotic products that it thinks will be of importance in the future, and listed on the screen. Next generation probiotics, that really means a wild type bacterium which has yet to be discovered but meets the World Health Organization criteria. That is, if you swallow it in sufficient quantities, it confers a health benefit to the host. So a next generation probiotic is simply a wild type species which is deemed to be beneficial to human health. And a live biotherapeutic product, slightly different that means a bacterium which has been genetically altered so that it produces a specific compound. So I'm sure you're aware with all the coronavirus vaccines and things like that a lot of biological compounds are produced by recombinant E. coli. So you change the genetic code of the E. coli so that it produces the compound you're trying to make as a byproduct of metabolism. And they have a special name, they're called live biotherapeutic products. So in this instance, you would modify a bacterium to produce a particular compound, and then you would swallow that bacterium, and it would colonise inside your gut, and it would produce whatever compound it was designed to produce. Now, what about probiotics in Europe? I don't hear you ask. Do you see the word probiotic on a lot of products? You probably haven't looked, actually, I accept that. But the answer is you do not. And the reason is because a few years ago, the European Union decided that the word probiotic was taken by a member of the public to mean providing a health claim. So what that would mean is anyone could make a product, they could put probiotic bacteria in it, they could put the word probiotic on the label, and when that was in a store, a patient or a consumer going in and looking at that product, they would see the word probiotic and they would assume that if they took that product, they would get in some way healthier. Okay, so the European Union made a decision that anyone wanting to use the word probiotic on the labelling of a product had to demonstrate the health claim associated with that product. Okay, so the way that you do that is you submit an application to the European Food Safety Authority, or EFSA, and you have to have done a clinical study which demonstrates a benefit to health in healthy people. You need to demonstrate the cause and effect, and you need to demonstrate what ingredient the bacterium is producing to cause that effect. Now that's really difficult for multiple reasons, one of which I already alluded to, which is that there are numerous bacterial species in the gut, and so trying to understand where your probiotic has gone and what it might be doing when it interacts with 1,000, 6,000, 10,000 other species is really difficult. Secondly, think about this if it was a clinical study and you had a very well-defined active pharmaceutical ingredient. You could do lots of in vitro studies, and when you do in vivo studies, you're looking for one thing. So you might be looking for the active or metabolite or something like that. In this particular instance, you're swallowing a bacterium, then you're asking a question about where it's gone. And clearly it's going to be in your colon somewhere, but that's not really an environment you can do sensible analytical measurements. Okay, so it's really difficult to get in vivo measurements for probiotic products. And it's one of the reasons why no one has gone to EFSA to try and to prove one of these claims. A number of companies, in my knowledge at least, have gone and tried to argue that their product is effective to use the word probiotic, but since this rule was introduced, EFSA has not approved any single claim, principally because I think it's set the bar so high for analytical measurement, it's not actually possible to get the data to justify the claim. So it means within Europe you can't use the word probiotic. Now, if we think about a product like Actimel, so there's 2 bottles of Actimel shown on the screen. The one on the left shows you what Actimel looked like before the European Union decided to ban the word probiotic, and you can see it reads a dairy-based probiotic supplement beverage, very clear as to what that is. The one on the right is the bottle of Actimel that you would buy at the moment if you went across the road to Waitrose, and you can see it just reads Actimel. Doesn't say anything else, does it? Because they're not allowed to use the word probiotic. So you may or may not have noticed that, but most products are not allowed to use the word probiotic in Europe. This is not the case if you go around the world. So Yakult is a product which is on sale in the UK, as I'm sure you are aware, contains Lactobacillus casei. If you look at how it's marketed in various parts of the world, you'll see a completely different approach. So the top packet of Yakult on the screen is the USA version, and you can see it reads exclusive probiotic strain. And the one at the bottom is the one that's sold in India, I believe, and it reads love your intestine. Every bottle contains 6.5 billion LCS that help improve digestion and help build immunity. And then to the left hand side it says probiotic food, fermented milk drink. So you are allowed to use the word probiotic in other markets, you're just not allowed to use the word in the UK. What that means instead is that manufacturers come up with really funky ways of avoiding that particular rule when they get very close to crossing the line, in my opinion. So here are some really good examples. If you look at the actual small print on a bottle of Actimel, it reads, Actimel is a delicious yogurt drink containing 10 billion exclusive L-casein cultures, calcium and vitamins B6 and D in every bottle. I think that would leave you in little doubt that by swallowing this, your health should improve. Right? But it doesn't actually say the word probiotic, does it? No. There are two other examples on the screen. Nutri-Advanced Probiotics, Probiotics. Okay, that's very close for me to the word probiotics, and I'm surprised that they got away with that. I would have thought any consumer looking at that product could be easily misled, but obviously it's permissible because it wouldn't be on the market otherwise. And then Boots Pharmaceuticals had a product called Digestion Support Biotic Cultures. That's pretty close to probiotic as well, isn't it? So what manufacturers do is they use words that sound very much like probiotic to convince consumers that there is a health benefit to the product. And I guess that the fact that the manufacturers are doing this is kind of a justification for why the European Union took the decision to ban the word probiotic in the first place. Now, I said already that there's not a lot of evidence as to which particular species and strains are useful in human health, but there are at least some guidelines and widely used bacteria that are usually found in different products. So I've listed some on the screen. The most common are lactic acid bacteria, or lab. Sometimes you see the word lab actually. Lactic acid is really important. I'm going to come back to it in just a second as to why you want that in the bacterium. But the two main groups that produce that are lactobacilli and pediococcus. I'm sure if you looked at some of the products, so that the Yakult and the Actimel, for instance, we already looked at, you probably know, but they contain lactobacilli. So it should come as no surprise that lactobacilli are often found in probiotic products. But there are some others. Most products that contain mixtures of probiotics contain bifidobacteria as well. But you might also see some other ones. Saccharomyces is a yeast, I think, Enterococci and Streptococci. Okay. I just note down here that Pediococcus are actually the bacteria responsible for fermenting cabbage in sauerkraut. We're going to mention fermented foods in just a bit. Now, before we stop for a cup of tea, another cup of tea, if you followed my advice at the start actually, I just want to review briefly the types of products that are on sale in the UK, so that if a consumer comes into your pharmacy and they say, I've been thinking about taking a probiotic and incorporating it into my diet, what are my options? The options are, you either buy a probiotic supplement, so that's something which is specifically formulated to deliver a probiotic bacterium, or more than one, or you incorporate something into your diet which naturally contains bacteria, and those tend to be fermented foods. So that's how I'll split them up on the screen. If you're going to go for a probiotic supplement, then your options really are liquids, solids, and sachets. Sachets, I think we would all agree, are solid, but they are at least granular, and they're designed to be shaken over food or dissolved in liquid before you swallow them, whereas tablets are designed to be swallowed whole, obviously. And liquid suspensions are bacteria suspended in water or yogurt or something like that. So some examples are shown on the screen. VSL3 is a sachet. It's also available as a capsule, actually, so that the granules are put inside a capsule. Probio7 is a capsule. And then if you're thinking about fermented foods in your diet, some good ones would be natural yogurt, kefir, kombucha, and various other fermented foods. The most obvious are sauerkraut and kimchi. Yeah, but you can ferment your own foods, actually. So if someone comes into your pharmacy and they say, what sort of probiotics can I think about incorporating in my diet? Those are the main ones that you might want to advise. Okay. Right, with that, we're going to stop, have a cup of tea, come back again in a few minutes, and then we'll carry on.